Hi, everyone. My name is Qaisar Mukhtar. I work with the Office of Global NCDs at U.S. Centers for Disease Control and Prevention. On behalf of the TEPHINET and CDC, I welcome you to a celebration of NCD publications by emerging authors from FETPs in Ethiopia, India, Thailand, Sierra Leone, Nigeria, Uganda, and Pakistan. My colleague, Dr. Sushma Acharya, and I are co-moderating today's event. We thank you for joining, and we invite you to introduce yourself in the chat box. Please feel free to type your questions in the Q&A tab as they come up. Next slide, please. We have an exciting program agenda. Dr. Reddy will kick off the program with opening remarks, followed by a brief overview of the Emerging Authors Program by me. Next, Sushma and I will present the authors, inviting them to highlight their NCD publications. And then Dr. Richter and Dr. Reddy will facilitate a panel discussion with authors about their writing experiences as EAP mentees. And Dr. Richter will conclude the event with her closing remarks. So without any further ado, I invite the TEPHINET Director, Dr. Carl Reddy, for opening remarks. Over to you, Carl.
Thank you so much, Kesa. So hello, good morning, good afternoon, and a good day from Atlanta, Georgia. I'm Carl Reddy, the director of TEPHINET, and I'm really pleased to open today's celebration of non-communicable disease-focused publications by FETP authors from 7 countries. This celebration is unique for several reasons. In 2021, TEPHINET coordinated and established World Field Epidemiology Day as a global movement to recognize and raise awareness of the vital role of field epidemiologists in protecting the health of populations, thus advancing global health security and advocating for increased investment in field epidemiology training, research, and professionals. We honored the first World Field Epidemiology Day in September 2021. By publishing infectious disease-focused field projects in a special supplement to the International Journal of Infectious Disease. Although non-communicable diseases such as cardiovascular diseases are the leading cause of death worldwide, they are often neglected. Therefore, to honor the second World Field Epidemiology Day, TEPHINET and the CDC Office of Global NCDs chose to highlight FETP NCD publications from the field. How did this pan out? In November 2021, TEPHINET announced a call for manuscripts showcasing global cardiovascular field epidemiology research. We received 23 proposals and selected 10 authors to work on their manuscripts. Another important element that I would like to emphasize is the need for building FETP scientific communication capacity. Publications from the field are critical to understanding the local disease burden, informing public health planning, and developing timely and effective interventions. However, many public health researchers, particularly in low and middle income countries, do not have the skill building tools and the necessary mentorship to effectively communicate key findings to diverse audiences through poster and oral presentations, reports, and of course, peer-reviewed manuscripts. In a recent survey conducted by TEPHINET, we asked FETPs about the type of learning content that would be of the most value to them. 86% of respondents, the N of which being 65, identified scientific writing, and 87% identified scientific presentation as the most valuable learning. I am pleased to share that the CDC Office of Global NCDs and TEPHINET recently launched a series of 4 online scientific communication courses to meet this critical need. These courses are accessible to anyone at no cost, and learners can access them at their convenience as often as they wish. The first such course on scientific manuscript writing was launched in 2020 on the TEPHINET website and has since registered more than 41,000 views from over 170 countries, thus confirming the need and demand for continuous support for scientific writing. Whilst these online courses are essential technical tools, new authors could also use a mentor who guides them in transforming their field project and research findings through a robust writing and publication process to peer-reviewed manuscripts. The final element I would like to underline is the Emerging Authors Program for Global Cardiovascular Disease Research, or the EAP, which provides publication mentorship by dedicated global mentors who volunteer to lend their expertise to selected authors from low and middle income countries and guide them through scientific writing and publication. Thus, the Office of Global NCDs has created a modernized and comprehensive model by combining self-study scientific writing courses with one-on-one mentorship. Today's webinar also celebrates the spirit of collaboration and support within this global community, dedicated to building scientific writing and publication capacity. I congratulate FETP authors from Ethiopia, India, Nigeria, Pakistan, Sierra Leone, Thailand, and Uganda on their successful publication journey. I would now like to invite Dr. Kaiser Mukhtar, the CDC EAP lead, to say a few words about this mentorship program. Thank you very much.
Thank you, Carl, for your encouraging and motivating remarks and for your continuing support of our efforts to build FETP NCD capacity. The Emerging Authors Program for Global Cardiovascular Disease Research, or EAP, was established in July 2019. This is a competitive scientific writing and publication mentorship program for new authors from low and middle income countries. This program relies on solid collaboration between the US CDC, CDC Foundation, the Lancet Commission on Hypertension Group, Resolve to Save Lives, and the World Hypertension League. Most of our mentors are from the Lancet Commission, followed by the CDC and RTSL. The program offers new authors one-on-one mentorship with global mentors on writing and publishing a manuscript with, while the mentors guide authors in writing a specific paper, the authors must understand the foundational principles of manuscript writing. For that reason, CDC and TEPHINET created technical training and tools to build authors' scientific communication capacity. Next slide, please. The online self-study scientific communication series created in collaboration with TEPHINET includes 4 courses. We started out with writing a scientific manuscript and launched that course in November 2020. This course is now also available in English and Spanish. To fully support FETP competencies, we added 3 more courses this year, conducting a literature search, developing and delivering effective oral presentations, and developing a poster presentation to this series. Please note that these courses offer a certificate of completion. While technical tools provide a foundation, researchers or authors still wish to interact with established editors, authors, and scholars to ask specific questions. So last year, we invited Professors Lackland, Welton, and Weber from World Hypertension League to teach an 8-part series on how to write and publish a scientific paper. On average, 514 participants from 82 countries attended this series, and 162 attended all 8 or at least 7 sessions and received a certificate of completion. This year, WHL faculty is teaching a 3-part series on building the evidence, literature search to systematic reviews and meta-analysis. The online scientific writing course and the webinar series continue to draw crowds, confirming the demand for building research, writing, and publication capacity. Next slide, please. So since the EAP launch, we have completed 3 EAP waves and recruited 10 authors for the 4th wave this year. Currently, 32 authors representing 2 regions and 9 countries have published 31 articles. The first group published 13, second group published 8, and the third group published 10 articles, 9 in Preventing Chronic Disease Journal and 1 in BMC Primary Care. The EAP team has published 3 editorials, a few more articles, and another editorial are under journal consideration. Next slide, please. Today, we're celebrating Wave 3 authors who responded to TEPHINET's call for NCD-focused publications in honor of the 2nd World Field Epidemiology Day. As Carl mentioned, we received 23 applications, selected 12 authors, 4 discontinued, 2 FETP authors from Wave 2 joined this wave, and 8 of 10 submitted articles have been published, along with 2 articles submitted by CDC and India programs. I want to take a moment to acknowledge EAP mentors who are the backbone of this program. Since 2020, 12 Lancet Commission on Hypertension group mentors have volunteered and shared their NCD research and publication expertise without any financial incentives. Here we present 3 of the commissioners, Drs. Herring, Nupani, and Scutri. They mentored 5 Wave 3 authors. Next slide, please. Our mentorship pool expanded a bit last year when several CDC colleagues joined EAP to mentor Wave 3 authors. And I want to thank them. Lastly, I want to acknowledge the CDC EAP coordinating team members. They work relentlessly behind the scenes to execute EAP's logistical and technical aspects seamlessly and successfully, leading to results I shared earlier. Next slide, please. So in summary, the EAP model has been successful beyond our imagination. Although our mentor pool has expanded some, the demand for NCD mentorship exceeds our capacity. We invite NCD experts with extensive research and publication experience to join EAP to help us materialize the vision to create local EAP chapters around the globe. And this concludes the EAP overview. Thank you.
Thank you. Thank you, Dr. Mukhtar, for this succinct and clear EAP overview. If you have questions for Dr. Mukhtar, please type them in the Q&A tab. And I'm Sushma Acharya, your co-moderator. Next, I invite all panel members to turn their video cameras on for a group picture. All panel members, if you could turn your camera on. And Sydney, if you could please help us take a picture. Thank you.
Oh, no.
Sydney, you don't have your camera on.
Oh, I'm included.
Yes.
Okay.
Yes.
All right.
Do we have Jackie? We don't see you yet.
Yes, I'm here.
All right. Yes.
Okay. Can you turn your camera on, Jackie?
We have her.
Oh, you have her.
Eva, we don't see you.
Oh, I see.
I'm not going to put my camera on.
Okay.
Okay. All right. Ready? Smile. 1, 2, 3. Beautiful. Thank you, everyone.
Okay.
Thank you, Sydney. Next, Dr. Mukhtar and I are excited to present our authors. Each author will take about 3 minutes to share what inspired them to apply for EAP. They will also discuss their publication highlights, including the unique contribution their study made to bridge the knowledge gap and the public health implications of their findings. Dr. Kesser, please introduce our first author.
Thank you, Sushma. So I have the pleasure of inviting our first author, Dr. Ashish Krishna. He recently graduated from India's Cohort 2 Advanced FETP NCD track. He is a senior technical advisor with Hypertension Control, resolved to save lives in India. His publication title is Understanding the Role of Staff Nurses in Hypertension Management in Primary Care Facilities in India, a time motion study. Dr. Ashish, over to you.
Thank you very much, Dr. Keshav. Next slide, please. So I'm very excited to share my EAP journey. I joined Emerging Author Program to achieve my FETP academic goals. So I was determined to enhance my scientific writing skills and seek opportunity to collaborate with the globally renowned mentors. So I was wishing that through their constant guidance, I aim to transform my research findings into compelling manuscript that can contribute to a meaningful to my field of study. Next, please. I would like to share what was my study objective. So under my study, I tried to estimate the proportion of the time that is spent by the staff nurses in performing hypertension-related activities in the selected NCD clinic in 2 states of India, which were Punjab and Madhya Pradesh. Next, please. Before starting this study, I did extensive literature review and identified that in India, primary health facilities nurses shoulder various kind of responsibilities. Nevertheless, their comprehension of specific tasks and time devoted to managing hypertension remains limited. So through my studies, I added that in the 6 primary NCD clinics where I conducted this study, nurses allocated approximately 2/3 of their time to hypertension-related activities. We identified that implementing digital data management at the staff nurses level brings significant advantages to their routine work because it helped them in reducing their time that is spent on the record management tasks. It was helpful for them in data retrieval for the patient follow-up becomes faster and it was more efficient, and facility equipped with the simple application, which was the digital data application that they are using. They can easily handle high load patient load, and it was enhancing their overall healthcare capacity. Coming to that, the implication of public health practice that was added to my study, that we identified that promoting the utilization of digital health records can significantly boost nurses' productivity, leading to the enhanced patient care. Thank you.
Thank you. Thank you, Dr. Ashish. Next, we invite Dr. Chanatip. He was part of the cohort 40 advanced FETP NCD track, and he graduated in 2021. He is a physician at the Pahan Hospital and also works as a field epidemiologist for the Ministry of Public Health, Thailand. The title of his manuscript is Availability and Price of Low Sodium Condiments and Instant Noodles in the Bangkok Metropolitan Region. Let's hear from Dr. Chinato.
Good evening from Thailand. For the inspiration for the EAP, first my goal was to publish in an international journal. When the EAP opened for application, I have 2 manuscripts. The first one has just been rejected. The second one, its draft has just been finished. I recognize the EAP that as an opportunity to enhance my scientific writing skills. I submit both manuscripts, hoping that the program would help me navigate the writing and publication process. Second, I was very impressed with all the features EAP had to offer, especially the opportunity to work with mentors from around the world. This aspect of the program provides invaluable guidance as I tackle the various stages of manuscript development and publication. Furthermore, this program also includes online courses and hands-on experience in writing, revising, and submitting manuscript, which was exactly the support I need to fulfill my ambition to becoming a published author. Let's talk about my project. Next slide, please. The study aimed to describe the availability and price of lower sodium and regular sodium condiments and instant noodles offered in retail stores, both large and small stores in metropolitan area of Bangkok, which is the capital city of Thailand. The rationale of this study was that Thai people consume sodium 1.8 times more than that the WHO recommended. At least 2 factors contribute to the high sodium intake. The first was the preference of seasoning food with condiments, and second one was the consumption of instant noodles. This study found that the lower sodium condiments were less available than the regular products, even though those were commonly used household condiments, such as fish sauce, soy sauce, and oyster sauce. The smaller stores, the wider gap in availability, including convenience stores and traditional stores. The price of lower sodium condiment was 2 to 3 times higher than regular sodium condiments. Furthermore, no lower sodium instant noodles were available. Therefore, it is essential to promote the reformulation of instant noodles. Convenience stores should get incentive and subsidize to increase availability and reduce the price of lower sodium condiments. Thank you.
Thank you, Dr. Shalik. I now invite Daniel Debel, who graduated from Ethiopia FETP in 2021. He received a CVD small grant in 2020. Daniel is a public health emergency management and health researcher in Oromia region. Daniel's publication title is Effects of an Educational Intervention on Lifestyle Modification of Patients with Hypertension at Bishoftu General Hospital, Ethiopia. Daniel, could you tell us a little bit about what inspired you to join EAP and then share highlights of your publication, please?
Daniel, sorry to interrupt. Kesa, some people cannot see the slides. I'm not sure if the technical team can just have a look. Thank you, Daniel.
Thanks, Carl. We'll just take a second. Sydney, are you there? Yeah, let's try again.
I'm here. Are you able to see the slides?
Yeah, I am.
I can see the slides as well.
There's a message in the chat to say, yes, it's now visible.
Okay, wonderful. Thank you.
Thank
Good.
you.
We're good.
Thanks.
Thanks.
Thanks, Carl. Danielle, over to you. Danielle? Hi, Danielle.
You are on mute.
Okay.
Yes, we hear you. Thank you.
Good afternoon, everyone. I have always had a deep passion for writing, and as a result, I could apply to this program where I was given an opportunity to having guidance and the support for skill development and ascertaining my literary desires, which including understanding the valuable chance of receiving guidance or mentorship or feedbacks from experienced scientific community to be capacitated for writing manuscripts, preparation, and publication. In conclusion, I am passionate enough about the program, impressive Richter, its commitment to diversity and prospect of learning from seasoned professionals, which were the key inspiration behind my decision to apply these emerging author programs.
Next slide.
Okay. My study objective is to investigate the effect of educational intervention on clinical measurements among hypertensive patients attending the outpatient department of Bishop Hospital in 2021. What is already known on these topics, blood pressure lowering and controlling are essential in reducing the risk of cardiovascular diseases. Hypertension burden is alarmingly increasing in Ethiopia, as well as limited evidence of educational and counseling intervention to lower the risk in Ethiopia. What is added by this study is a 3-month educational intervention focused on health lifestyle among patients with hypertension was effective in improving systolic and diastolic blood pressures, wide and total cholesterol. Public health implication, when we see the public health implication, establishing educational and counseling program for patients with hypertension in health facility and community will promote a healthy lifestyle and in turn help reduces the risk for cardiovascular diseases. Thank you very much.
Thank you, Daniel. Next, let's hear from Dr. Akina Uno. He graduated from Nigeria Cohort 10 Advanced FETP in 2020 and also received a CVD small grant in 2021. He is currently enrolled in the Doctor of Global Health Leadership and Practice program at the University of Washington, Seattle. But he was working as the assistant director in the Emergency Operating Center Division at the Nigeria CDC office when he participated in EAP. His manuscript focused on the prevalence and predictors of tobacco use among adolescents in Ibadan, Nigeria. Over to you, Dr. Akina.
Okay, thank you very much. So my inspiration to apply for the EAP was prompted by a pre-existing interest in NCDs, especially in low resource settings. And this was prompted by a couple of personal tragedies and a realization that we were not putting as much emphasis as was required based on the numbers with regards to morbidity and mortality statistics. And of course, the opportunity due to or facilitated and curated opportunity to publish in a high impact journal was, an additional incentive. In addition, we're working with global mentors and a different set of perspectives to what I'm used to. Okay. So these were my study objectives to determine the prevalence and patterns of tobacco use among school-age adolescents in Ibadan, Nigeria, and to determine the predictors of current tobacco use amongst them.
Next slide.
Okay. So with regards to the highlights of the publication, prior to implementing the study, we found that as much as 90% of tobacco use starts in adolescents, and there was some documentation to show that in Nigeria there was evidence of as early as 7 years start of tobacco use. And the problem with early tobacco use is the higher likelihood of dependence, prolonged use, and even increased health consequences. And at the time where we were thinking of the study, more than 10 years had passed from the last survey of tobacco use amongst adolescents. So at the time, the current status of adolescent tobacco use in Ibadan, Nigeria was not really known. So what was added by our study was the fact that there was a 2% prevalence of adolescent tobacco use. And some of the factors that were associated with tobacco use were peer influence, access to cigarettes, misperceptions about tobacco use, exposure to secondhand smoke, and tobacco advertising. So with the implications of our study were the need for a country-level comprehensive national adolescent tobacco control strategy, which should be centered around an anti-tobacco campaign and enforcement of bans on tobacco advertising and public smoking, as well as guided by a continuous surveillance and monitoring, to help with the implementation of the strategy. Thank you.
Thank you, Dr. Akina. Our next speaker is Jacqueline Nanono, a recent graduate of Uganda Advanced FETP. Jackie also received a CVD small grant in 2018. She is an associate with Makerere University School of Public Health in Uganda. Jackie's publication title is Service Availability and Readiness of Primary Care Health Facilities Offering Hypertension Diagnosis Services in Wakiso District, Uganda. We will now hear from Jackie.
Yes, hello everyone. My name is Jackie. Thank you, Dr. Kaise. Yes, what inspired me to apply for the EAP? One is wanting to join a global scholarly program like the opportunity being presented by the EAP with diverse mentors and supervisors, and I'm very glad I got onto the program. Then two, interest of becoming a scholar, joining scholarly writing and joining the academia. Then three, the need to publish my first research work conducted in 2019, which was funded by TEPHINET, and I consider that as a rare opportunity for me, which is rarely got by many. Yes, then finally, wanting to share my findings from my study to the entire globe. So that's the why I was inspired to join the EAP. Next slide, please. Yes, for hypertension diagnosis services at primary healthcare facilities in Wakiso District, I assessed services available and readiness for appropriate diagnosis for hypertension. Then two, I described facilitators and barriers faced by the health workers when offering the diagnosis for hypertension. Next slide, please. Okay, then publication highlights what is already known on this topic. Screening and early diagnosis of hypertension programs are limited. Thus, hypertension is largely undiagnosed across the globe. Then what is added by this program? Most primary health care facilities offer diagnostic services, but few have functioning diagnostic equipment. Then another issue, refresher training is rarely available for some of the health workers in the health facilities which we went and conducted the study. Then what are the implications for public health research? Inadequate supply of essential equipment, routine replacement or repairs of damaged equipment, and frequent refresher trainings for health workers can enhance the hypertension diagnosis services. Yes, thank you. That's all.
Thanks, Jackie. Now we present Dr. Nadia Noreen. She was part of cohort 10 of the Pakistan FETP and graduated in 2018. She was also a CVD small grant recipient the same year. She is a technical lead for border health services under the Ministry of Health Regulations in Pakistan. Her manuscript focused on the determinants of adherence to anti-hypertension medications among patients at a tertiary care hospital in Islamabad, Pakistan, 2019. We will now hear from Dr. Nadia.
Thank you so much, Sushama. Good afternoon and good evening, everyone. So what inspired me to apply for the EAP program? I saw it as an opportunity to leverage my writing skills and to advocate for the improved prevention, treatment, and the management of the hypertension to publication in a high impact factor international journal. It was one of a great opportunity for collaboration with the subject matter specialists and the organizations in the related field, enabling knowledge sharing and the networking. It is a great platform for the extraction and the collaboration of the thought, ideas, and the expertise. And it was one of a great opportunity, and it was a medium for change to create awareness, educate, and influence. It provided me an opportunity for the professional skill development and recognition of my writing skills through the supportive mentorship I received through this program. And not least, but the last, to make a positive impact on the individuals and the communities. Next slide, please. So my study objectives were the identification of the factors causing adherence to the antihypertensive medications. And the factors which I studied were socio-demographic factors, patient-related factors, health services, and access-related factors, disease-related factors, medication-related factors. Next slide, please. Next. So the publication highlights what is already known about this topic. There's high prevalence of uncontrolled hypertension in Pakistan, and improving the medication adherence reduces the burden of the cardiovascular disease. What my study has is added the factors influencing the medication or adherence were identified, and these factors were unaffordability, female sex, and the long waiting times in the healthcare facility. The factors that influence and improve the medical adherence were the effective counseling and the state covered medication provision. So what are the implications for the public health practice from my study? An action plan with targeted interventions and policies is needed to promote optimal medical compliance within the Pakistan National Action Plan for the Hypertension Prevention and Management. That's all. Thank you so much.
Thank you, Nadia. And I now invite Umaru Sesay, a graduate of Sierra Leone Intermediate FETP. Umaru graduated in 2021, and in 2020, he also received a CVD small grant. Umaru is a disease surveillance officer and a mentor for the National FETP Intermediate Program with Ministry of Health and Sanitation in Sierra Leone. Umaru's publication title is Evaluation of a Hypertension Surveillance System, Kenema Government Hospital, Sierra Leone. I invite Umaru to present, please.
Thank you so much, Dr. Kesa. My inspiration for applying for the EAP. Sierra Leone, like many other low and middle income countries, has limited research opportunities, especially in the area of scientific writing and publication. In 2021, when I heard of the EAP application through my program director, for me, I was very curious because I saw it as an opportunity for me to practice the knowledge and skills which I have acquired from the in-service FETP training program on scientific communication. And as well, I was interested to learn new concepts through mentorship from global mentors and further unlearn outdated practices. Secondly, I saw the EAP as an opportunity for me to gain in-depth ability in sharing NCD-related findings with the scientific community in the peer-reviewed journal, especially when I just completed project. And finally, I also saw the EAP as an opportunity to network with colleagues, FETP trainees and mentors, and to share best practices and challenges in scientific writing. Next slide, please. This was my study objective. The objective was to assess key attributes of the hypertension surveillance system to determine if it met its objective of estimating and monitoring the trend of hypertension at Ken Magono Hospital, Kenma District, Sierra Leone. Next slide. Next slide, please. Publication highlights. What is already known on this topic? From literature review, hypertension surveillance system was established to monitor the trend and patterns of hypertension. Since its establishment in Sierra Leone, we did not know how effective the hypertension surveillance system has been performing prior to this study. In this study, I found out that although the system was relatively stable, however, there were gaps in data collection, analysis, and dissemination. Furthermore, I also found out that the usefulness of the surveillance system was poor and needs improvement to estimate the true burden of hypertension and for it to continue to monitor future trends. The implication of my study findings for public health practice. I believe strengthening the surveillance system requires strategies, including a supervision system has to be put in place. And the staff also need to be trained for timely data collection, input, and analysis for dissemination for public health action. Thank you so much for the opportunity and the audience. Thank you.
Thank you, Umaru.
Kaisa, sorry to interrupt.
Yeah, we can see the slides. We're getting messages, both that some people are not able to, others are able to see.
I'll just stop and reshare again.
Yeah, let's do it one more time, maybe.
Can you see?
I can see.
Yeah, I can see.
Maybe some of the colleagues, yes.
Yes, we can see. Yes, I think we're good now.
Okay.
Yes. Thank you, Umaru, and we thank all the authors for your dedication to publishing NCD projects from the field. These publications cover a wide range of CVD topics with significant public health implications, including hypertension diagnostic services, program evaluation, tobacco use among children, sodium intake, and medication adherence. Please note that we are working with TEPHINET to develop visual abstracts for these publications, so please stay tuned. It is my pleasure now to invite Dr. Richter, the Chief of the CDC Office of Global NCDs, and Dr. Reddy to facilitate a panel discussion with authors about their experience as EAP mentees. Over to you, Dr. Reddy and Dr. Richter.
Good. Thank you, Sushma. Thank you so much for the opportunity. You know, we've heard extensively about this amazing opportunity that EAP presents, and of course, the need for mentorship. So in view of that, I'd like to ask Dr. Chanatip, please could you share your experience with global mentors, including the strengths of their support and any areas that you think are needed for improvement. Please go ahead, Dr. Chanatip.
Yes, I think when participating in EAP is a great experience. For the first strength of the mentors was the global perspective of health policy. They suggest I to apply my findings to the global context and encourage me to incorporate best practice into my research. Mental command of English language also proved to be very beneficial. They help me effectively communicate my findings and articulate my ideas fluently. The EAP team's experience in working with journals, editor, and reviewers was a significant advantage. They provide support in formatting, writing a cover letter, and responding to reviewers, specifically tailoring my submission to the PCD journal. Last but not least, the support and encouragement play a vital role in keeping me motivated. During times I felt burned out by the demands of addressing by the reviewers' comment, they suggest that I reach out to editor for an extension, allowing me to continue revising my manuscript. And finally, I completed. Thank you so much.
Thank you, Dr. Chanatip. And just very quickly, any areas for improvement that you could think of in terms of the mentorship?
For the improvement, I think it's nothing to improve, because the best thing that I like is the global perspective from the mentors. Because when I write in the context of Thailand, I don't think about the global context. But when I want to submit to the international journal, I would think about the application of my finding to the other countries.
Okay, thank you, Dr. Chanatip. Patricia, I'd like to hand over to you.
Thank you, Carl. My question is for Daniel Debel. Daniel, what was the best part of your EAP experience?
Daniel, we can't hear you. Can you get closer to the to your laptop maybe and speak louder?
We still don't hear you, Daniel. Daniel?
Yes, yes.
Yeah, now we hear you. Please speak a little louder.
Okay.
Yes, great, thank you.
The best part of my emerging author program experience is the PhD publication was my first manuscript and my first scientific writing mentorship experience. It was greatly satisfying, and it offered me an opportunity that I would not have received elsewhere. I gained valuable skill and knowledge about developing scientific manuscripts and the submission process, and improved my writing style. Those skills are invaluable and will continue to benefit me throughout my life. Some of the best emerging author program experience I had included extraordinary coordination, remarkable team spirit, availability and dedication of mentors, their encouragement, close mentoring, and opportunity for discussion with established scholars. I got the opportunity to develop scientific writing skill, expand my knowledge, and practice through close discussion and feedback from mentors. The mentors provide me with solid advice and direction, and helped me identify and address the strengths and the weaknesses of my researches. In addition to the mentors, the CDC Emerging Author Program coordinators and many others offer further guidance and support throughout the writing process, keeping me motivated and focused. In short, the Emerging Author Program experience was highly rewarding. It improved my writing skill and contributed to my personal growth. It is greatly pleasure for me to continue working with this team in the future. Thank you very much.
Excellent. Thank you for that response, Daniel. Over to you, Carl.
Thanks, Patricia. So my next question I'd like to address to Umaru Sesay. Umaru, please could you share your experience with the support you received from the CDC EAP team during your writing and publication journey? And are there any ways that the team could have supported you better? Please go ahead.
Thank you so much. Thank you so much, Doctor. Regarding my experience, support provided from the EAP. First of all, regarding the mentorship and supervision, for me, the support received was excellent. This is because the mentors maintain an open door policy and they provided valuable technical input throughout the manuscript writing process. The technical and editorial support received was instrumental in improving the manuscript quality, particularly through the mentor's guidance in addressing reviewers' comments and suggestions. Secondly, the virtual webinar series on scientific writing was exceptional and timely. The facilitators efficiently explained all the concepts and provided opportunities for us attendees to ask questions. And thirdly, the prompt distribution of audio recordings and PowerPoint slides after each webinar session was outstanding and helpful. And fourth, the self-study online courses provided for science.
Umaru, you've frozen. I think maybe your connectivity.
Scientific writing, we are very, very helpful. For me, I used those online course materials while writing. The second part, if there were ways the team could have supported me better, for sure. One key way, which I think for some of us EAP authors, we struggle to download relevant literature for our manuscript writing. This is because some articles required fee for requirement for the acquisition. And I believe it would have been greatly beneficial if the CDC team could have provided support in accessing an online library for downloading the necessary literature, which will have helped us to ease our writing process. Thank you so much, Doctor.
All right, thank you, Umaru. That's a very interesting point that you raise about access to published material. So thank you, that has been noted. Patricia, I hand over to you.
Thank you, Carl. My question is to Dr. Ashish Krishna. Dr. Krishna, what advice would you give emerging authors considering joining the EAP or wanting to publish in a peer-reviewed journal? I know that there are several in the audience for this session that would be very interested in your advice on this.
Thank you, Patricia. This is a very interesting question. So I suggest that if you want to enroll in EAP program and if you want to enhance your scientific writing skills, so it is not a one-day process, it is a constant learning. So it is crucial that you engage in consistent practice and reading. You can enroll, as it was suggested earlier, in CDC web-based scientific writing training module, which is totally free of cost. It can provide you a very valuable guidance. Additionally, you can familiarize yourself with the specific requirements of the program or journal you are targeting and tailor your work accordingly. Many times it happens that you are very busy and you don't adhere to timelines, then it is going to be a very cumbersome process. So it is very important that you stick to your submission timelines. Finally, actively seek constructive feedback from your mentors and carefully observe the changes that they are suggesting in your manuscript, as this will help you to refine your writing and improve your manuscript. Thank you.
Thank you. Carl?
Okay, thank you, Patricia. My next question is for Noreen. So, Noreen, as an EAP alumnus, how do you plan to support Pakistan FETP trainees in their scientific writing? And then the second part of that is, what support do you need from your local mentors to continue your own publication journey? Well, let's address the first question, the first part.
Thank you so much, Dr. Kerr. EAP was a wonderful experience, and I have learned a lot from my mentors. I'm very grateful to the EAP team for the supportive mentorship I have received as an alumnus. And as an alumnus, I'm all ready and committed to support the cause of the EAP through providing mentorship. I volunteer myself to peer review the manuscripts that are submitted by the current and the future program participants for constructive feedback and suggestions for improvement through what I have learned myself from my mentors. And I want to continue to contribute to the learning process through continuing education and by training and by offering the workshops, webinars, and the training sessions on the specialized topics for the local FETP trainees and graduates in Pakistan. And I'm very keen to share the CDC TEPHINET developed tools and resources on the scientific writing with my colleagues. As in Pakistan, we lack the mentorship opportunities. We lack such opportunities because we can't afford to pay for such high impact journals. We can't afford to pay the fee. So it was a great opportunity, and I myself want to continue to participate in and promote through various ways and means by participating in the monthly NCD professional development webinars and utilize the future tools for research and scientific writing. So I'm looking forward that I continue my publication journey as a FETP graduate, and I get more chances to participate in kind of courses like I have seen that we have EPI tools and EPI trainings through TEPHINET. So I'm looking forward as a FETP graduate to join those trainings. And I once again want to thank the AP team, and I'm very grateful for the all support I have received, and especially my mentor, Professor Dagmara Herring. And it was a wonderful experience to work with you all. Thank you so much.
Thank you so much, Noreen. Over to you, Patricia.
Thank you, Carl. My question is for Jackie Nanono. Jackie, you published your first article as an EAP mentee. How did this publication support your career advancement?
Thank you, Patricia. I'm extremely proud to have my first manuscript published in the Journal of Preventing Chronic Diseases. This accomplishment holds great significance for me and has contributed the more to my career advancement in several ways. In my current workplace at the Infectious Diseases Institute, every publication is acknowledged, even if it's just one. Emails are sent, words of congratulations, praise, and encouragement are mentioned by supervisors and colleagues. And some of my peers have requested for advice on how to publish a manuscript. Because publishing a manuscript is counted an accomplishment, a pride is attached to it. And that advice I have offered to my colleagues on how to publish a manuscript. Since my publication, my job responsibilities have undergone some changes. Over the past 3 months, I have been assigned the role of team lead for various activities. For example, coordinating meetings, overseeing staff training at health facilities and in the community, managing activities related to pan-respiratory disease and event-based surveillance, where I'm currently working at IDI. Yet also, I'm taking over project roles for colleagues who go on leave and representing my supervisor on several activities for high-profile meetings and workshops. Additionally, I believe that this publication will also support my interest in pursuing a doctorate degree. Yes, due to being part of the EAP, I have reviewed abstracts for the FETP International Nights 2023, which was successfully held in April 2023, and this gave way to other invitations for other abstracts review, like the upcoming 12th TEPHINET Regional Scientific Conference of the Americans. That one is happening in September this year. Thank you.
Thank you, Jackie. Over to you, Carl.
Great. So now I have a question for Akina. What are the challenges in finding mentors to support NCD-focused field projects and publications? It's a difficult question, but yeah, please give it a shot.
Yeah, sorry, I was muted when I started talking. Okay, so thank you, Carl. I would probably answer with the Nigerian context in mind, and I will say that my experience and my observation is the fact that the underlying thing is there's an overemphasis on communicable diseases relative to non-communicable diseases in the Nigerian context, and I guess in other related low resource settings. And what this has led to is less investments and training opportunities and research funding committed to NCDs. And of course, this has made NCDs less attractive with a fewer pool of experts to call on. And a bit of something I think might be a cascade effect of this, and also maybe the historical pathway of the FETP program is the fact that there's even that emphasis on infectious related to NCDs, infectious diseases related to NCDs is even more accentuated within the FETP network. So over time, a pool of FETP trained and affiliated researchers and practitioners specializing in communicable diseases have been built up. with very few who are aligned towards NCDs. And the observation has also been, even where you see those that have done some work in NCDs, it's mostly like an added on interest to other things they're doing. And there's a lack of depth as you would want from proficient mentors. So I think at the end of the day, what is undergirding everything is that consistent emphasis on communicable diseases as opposed to non-communicable diseases, which is really not in keeping with what the numbers are saying at this time, considering that a bulk of morbidity and mortality from NCDs are from low resource settings. I think that's what I would, the response I would give. Thank you.
Sure. Akina, I'm going to challenge you, given what you just said about the statistics, the numbers on non-communicable disease, and given the fact that FETPs should ideally focus on the health priorities, right, in their context, in their countries, and obviously if NCDs is an important part of the health priorities and the context of a country, what can you think of any strategies or can you think of any interventions that would help FETPs to sort of accommodate NCDs or also focus on NCDs? Can you think of any strategies that, could be discussed or?
Okay, so what I think one thing I've noticed, which I'm not sure why I haven't seen this in a context like Nigeria, I've realized that certain country FETP programs have NCD tracks. So I think that is really, I would guess that is based on a deliberate effort within those country contexts to address the imbalance. So I think guided by what the numbers are saying, what the health priorities are saying, just like you pointed out, maybe countries should be encouraged to set up NCD tracks. And of course, what also influences what works is the funding that is committed to it. So if those tracks are set up, I guess some measure of funding and budgets, can go in that track and support the training opportunities that are needed, building up the research infrastructure. And of course, it might take a while, but over time, what the setup needed, the infrastructure will be built up. So I think is that being deliberate about committing resources to building up the NCDs specifically, because it might be lost as it is right now, where it's just an open pool in some countries. So if you have interest in NCD, you can do that. But the system would mostly channel you towards the communicable diseases because there's more expertise, there's more support, maybe there's more funding, there are more opportunities there. People would naturally gravitate towards that. But if there's a deliberate attempt to create something specifically for NCDs, I think it will start to address the imbalance.
Sure. No, thank you for that, Akina. And, in addition to a specific track for NCDs, what some FETPs have done as well is they've negotiated with NCD field sites, right? So for field placement of trainees, for example, they've negotiated with the National Cancer Registry to have an FETP resident placed there for the field placement. They've negotiated with the National Center for Violence and Injury, right, to have a resident place there and so forth. And of course, there's the NCD programs of the National Ministries of Health as well, so to have field placement sites that are NCD focused as well. So, thank you so much for that. Sushma and Kaisa, thank you so much. I'd like to hand over to Patricia now for closing remarks.
Thank you, Carl. I congratulate the authors who participated in today's celebration. Learning about the highlights of your key findings and recommendations has been a pleasure. Our office supports FETP NCD capacity building with a limited budget and a small team, and we must strategically use our monetary and human resources. While I was aware of the EAP's success and the impressive acceptance rate, I am delighted to hear firsthand from each author about your positive experience with global mentors and the value of support you received from the CDC EAP coordination team. And I'm happy to hear that the visionary idea of creating online scientific communication tools to expand the reach and access proved to be a hit. I appreciate hearing about the positive impact of publishing on authors' career advancement. While EAP can only accept a small number of authors each year, we realize the need for NCD publication mentorship is much more significant. I echo Dr. Mokhtar's call for experienced NCD mentors to join EAP and encourage authors who have been part of EAP to share their knowledge with peers and create a network of local EAP chapters. Publishing is a team effort requiring hard work from authors and dedication from their local and global mentors. So please join me in thanking local and global mentors who continue to share time and expertise with new authors without financial compensation. EAP is an excellent example of advancing the global health equity agenda, particularly in reducing disparities in global health research and evidence generation. I thank Carl and TEPHINET for being a champion of NCDs. Our monthly NCD professional development webinars continue to draw crowds. Our joint response to building scientific communication capacity has expanded our reach beyond our expectations. In 2019, we hosted a 3-day scientific writing workshop in Atlanta and trained 35 people from 8 countries, which was a success. But modernizing curricula and posting self-study courses on TEPHINET's website allowed us to reach over 170 countries and counting. We're grateful for this partnership and look forward to continuing innovation and creativity. Thank you all for participating in today's celebration. We wish authors much success and many more publications, and thank local and global mentors for their unwavering support and contributions. Thank you.
Thank you, Patricia, Carl, and again, congratulations to Ashish, Jackie, Daniel, Umaru, Noreen, Kenna, and Chanatip for sharing your insight and recommendations. There are several questions in the Q&A tab. I believe most of them have been addressed or are unclear who they were for. We will try to address them in an email when possible. And also want to let you know that for the next EAP opportunity announcement, please continue to check the TEPHI Connect. That's where the announcements are usually posted. And thanks again, everyone. We really appreciate your active participation, and have a wonderful day. Bye-bye.
Thank you very much for the opportunity and the NCD team. Thank you.
Thanks, everyone.
Thank you.
Thank you, everyone.
Thank you.
Thank
Thank you.
Keep up